Hi. I'm Rose, one of the triage nurses in the emergency department.
Hi.
Can you tell me your full name and date of birth, please?
Mr Donaldson. My date of birth is the 16th of May 1982.
Thank you, Mr. Donaldson. Can you tell me why you've come here today?
I accidentally stepped on some small bits of glass when I was in the park earlier today. I was playing ball with my children and had taken off my shoes because it was hot. I went to get the ball from under some bushes and didn't notice that there was some broken glass there, and I cut my foot quite badly.
Right. Can you tell me a bit more about the injury? Did the cut bleed a lot?
Yes. It bled a lot at first.
What sort of first aid measures did you take?
I tried to clean my foot with water from my water bottle. Then I wrapped a cloth around my foot. I don't know how clean the cloth was, but it was all I had.
What about your pain level at the moment?
My foot hurts a lot and it feels like there are still pieces of glass in it. I took some pain medication about 30 minutes ago, which helped a bit.
All right. Thanks for that information. I need to ask you some questions about your general health now, if that's okay.
Sure.
Do you have any health conditions?
I have asthma, but it's only mild. I use an inhaler if my chest is tight and I'm wheezing.
Okay. Do you take any other regular medication?
No, apart from paracetamol if I have a headache.
When was your last tetanus vaccination?
I can't remember. It was probably several years ago. I haven't had any injuries to need one.
Okay. I'll let you know what will happen now I've finished the triage assessment. I'll take your vital signs, then you'll go back to the waiting room. Then, you'll be examined by an ED doctor and have your wound checked. After we clean your wound, you'll need an X-ray to ensure any glass has been removed. After that, you'll have a clean dressing applied.
Okay. I see.
It's also important that you have a tetanus vaccination. There are several reasons for this. Firstly, you're unsure when you had your last vaccination, so you may not be protected against a tetanus infection. Secondly, you may have a contaminated wound because you may have come into contact with bacteria through the cut in your foot.
I really don't want to have a tetanus injection. I've never heard of anyone getting tetanus, so I don't think it's necessary. I hate having needles as well.
I appreciate that you may not have heard of cases of tetanus, but it is still possible to contract a tetanus infection if you are not protected by vaccination. Tetanus is a very serious infection which can have serious consequences. It can cause painful muscle spasms and muscle rigidity in the jaw, causing difficulty swallowing. If the infection progresses, you may experience painful spasms in your body as well as difficulty breathing. Tetanus infection is a medical emergency.
Oh. I didn't realize it was so serious.
Yes. It is. There is no specific treatment of the infection apart from symptom management. But, it can be prevented by tetanus toxoid-containing vaccines. A lot of people don't like the thought of having needles, but I can reassure you that the needle used for the vaccination is very fine and the actual procedure is quite quick. I can also apply numbing cream to your arm before you have the vaccination, if you like. That helps to dull the feeling of having an injection.
Right. I understand about how serious tetanus is now. I'll have the tetanus vaccination after all, but it might be a good idea to have the numbing cream before.
Okay. Are you happy for me to take your vital signs now? Then the doctor will see you.
Yes. That's fine.